Now, having gone through all the symptoms, the risk factors, the complications, how do you know if you have diabetes mellitus? Well, when you visit your physician, he would basically carry out one of three tests. Now, the most accurate test that a physician could carry out is known as the HbA1c test. Now, this test basically gives you a blood sugar reading over a 2 to 3 month period. Okay, if your HbA1c level is 6.5% or higher, it is an indication that you have diabetes mellitus. Okay, the doctor could also do a random blood sugar test. In other words, you would draw out a vial of blood randomly. If the blood sugar level within the blood vial is approximately 11 millimole per liter on 2 separate occasions, along with symptoms, again, it's an indication that you have diabetes. If the level is in the region of 8 to 11, it means that you are a pre-diabetic, and your chances of developing full diabetes is obviously greater. The doctor could also carry out a fasting blood sugar test. In this case, the person would basically fast from the night before until the time he sees the physician. A blood vial or a blood sample is taken from the patient. If the blood sugar level is in the region of 5.6 or below, it is normal. If it is 5.6 to 7, it means pre-diabetic, and if it is 7 or above, it is a definite indication that you have diabetes. Okay, now, how do we treat diabetes? Right. For the type 1 diabetes, which is basically your insulin-dependent type diabetes mellitus, obviously you're going to require the utilization of insulin. Now you get different kinds of insulins. You get long-acting insulins like Lantus or Levemir. You get intermediate insulins like Mixtard or Isophane, okay, Insulatard, or short-acting insulins like Novorapid, Actrapid, which is generally utilized immediately after a patient has a meal. Okay, now obviously every type of insulin regimen is not the same, for all people. Obviously every patient requires a different regimen to suit that patient's needs. There are some patients who might only need a short-acting insulin. There are others who require maybe just a daily dosage of insulin. There are others who basically require a combination of insulin. So this is something you need to discuss with your physician. Now, insulin comes basically, you get two types of insulin. You get your insulin vial, and the vial looks like this. It comes in a box, and there's usually 1,000 units in the vial. Okay, there's 1,000 units in a vial. With the vial, the patient would be given an insulin needle. Okay, so they would basically inject the insulin from the vial and basically inject themselves. The one that I like is basically the pen. I think the pen is very, very nice. Okay, it's a nice, slick gadget. Okay, you open it. The insulin is at the bottom. Okay, that's the insulin. It's clear. You stick in a needle at the bottom. The patient would simply turn the gauge to how many units he basically requires, and then inject themselves. This is the one that most patients actually prefer. Okay. How do patients inject themselves? They basically form a pouch on their skin, okay, and then inject themselves. It is a very painless process. They won't even feel the pain. They normally tend to inject themselves on the abdominal region or in the thigh area. Insulin should be kept in the refrigerator. All insulin should be kept in the refrigerator except the insulin that they are using. So the insulin pen that they are using or the vial that they are using can be kept at room temperature. Now, for type 2 diabetes basically is the one that I discussed earlier, whereby the body simply produces an increased resistance to the effects of insulin. Okay, so these patients would generally go on to oral therapy. For some patients, they might require one drug. For others, they might require a combination of 2 or 3 drugs, depending on the level of the blood sugar. Again, this can be discussed with your physician, to try and find a way to produce a regimen that optimizes benefit to the patient, and obviously brings down the blood glucose sugar levels. Now, we get different classes of oral therapy, and this would basically include your alpha glucosamide inhibitors, your sulfonylureas, your meglitinides, your thiazolidinediones, and your dipeptidyl peptidase inhibitors. Okay, that's the classes of drugs. Now, how do these drugs work? They basically work by, number one, either stimulating the pancreatic cells to produce more insulin. They could also work by inhibiting the liver to release the glucose into the bloodstream, or they could work by simply blocking the activity of the stomach enzyme that breaks down the carbohydrate and basically cause tissue cells to become more sensitive to insulin. Okay. Now, some of these drugs would include drugs like Diatab. Diatab is a very common oral therapy. Comes in a box like that. Okay. We have other drugs like Actos, okay, which is your pioglitazone. This is sulfonylurea. Very common one that most people know is glucophage. Okay. Oops, upside down. Glucophage. I think last but not least, after discussing, the symptoms, the contraindications, obviously if a person has diabetes, they have to undergo lifestyle changes and lifestyle modifications. Okay, now many people believe that diabetics can only eat certain types of food, and they shouldn't eat certain types of food. That is actually quite the contrary. A diabetic basically should eat all types of food, but within moderation. They should include more fruits, more vegetables, more whole grains, and stay away from sugary stuff like cool drinks, excess sugar. Try and stay away from the sugary stuff. It is better for a diabetic to have a few small meals throughout the day instead of 1 or 2 big meals. Okay. Again, if a patient is smoking, try and let them quit. If they have blood pressure, if they have cholesterol, that has to be controlled. Alcohol is a big no-no, when you're a diabetic. And I think the most important thing for all conditions, all ailments, is physical exercise. 30 minutes of walking every day does wonders for the body in terms of alleviating and reducing high blood pressure, cholesterol, as well as diabetes. Okay. A last point of note is when a patient is taking insulin, it is very, very important that they do not inject so much of insulin that causes the blood sugar levels to drop. And that is when the patient can go into a state of hypoglycemia. Now, some of the symptoms of hypoglycemia will include shaking, sweating, irritability, a feeling of faintness, okay, dizziness, right? The patient's face actually becomes pale. So it is very important that if a patient is taking insulin, they should always have a glucagon kit on them all the time. Now, glucagon is another hormone that the pancreas produces. And what this hormone does is in our body is it converts the glycogen back into glucose. Okay? If the patient doesn't have a glucagon kit, they should have something sweet on them all the time, like a glucose bar, a chocolate, a peanut butter sandwich, anything sweet, just to make sure that they do not go into a hypoglycemic state. Because if your sugar goes very low into hypoglycemia, you could land up in a coma. Okay, that is another very important point to take note of. Anyway, I hope that today's topic has interested you. I hope that I have given you all the facts regarding diabetes. And I do hope that you join me next time on another episode of Pharmacist Online from me, Sumaya. wishing you good health.